So welcome to our presentation of homelessness in LA County. This is from Emily, Greg, and Mandy. What is the definition of homelessness? It is a state that occurs when an individual or family lacks a fixed, regular, and adequate nighttime residence, such as those living in emergency shelters, transitional housing, or places not meant for habitation. Or it's an individual or family who will imminently lose their primary nighttime residence within 14 days, provided that no subsequent housing has been identified and the individual family lacks support networks or resources to obtain their housing. Or it's an unaccompanied youth under 25 years of age or families with children and youth who qualify under other federal statutes. Or it's an individual or family fleeing or attempting to flee domestic violence, has no other residence, and lacks the resources or support networks to obtain other permanent housing. And then we have definitions from the Social Security Administration. Person experiencing homelessness is an individual with no permanent living arrangement, someone who is transient, someone who sleeps in doorways, overnight shelters, parks, bus stations, etc., or a person who stays with a succession of friends or relatives. In Los Angeles, on any given night, according to the latest Services Authority's report, 75,518 people are experiencing homelessness. This is in LA County. This continues a steady growth trend of people experiencing homelessness in the annual point-in-time count. A continuing concern still reflected in the 2023 count is the percentage of homeless persons who are Black African American. This group represents 32% of homeless individuals in LA County, as compared to only 8% of the population in LA County overall. People experiencing homelessness are from a variety of different ages and experiences. 8% are under age 18, 30% are female, 2% are transgender. You can see all the diversity there. 42% are chronically homeless, and 30% have substance abuse disorders. Only 25% are suffering from serious mental illness, and that certainly defies a lot of stereotypes. Although homeless people are found throughout the county, the largest concentrations continue to be in the metro central LA region. And most are from the Los Angeles area and stay in or near the communities from which they came, another debunked myth in that stat.
So now we will move on to the point in time breakdown stats. The numbers obviously cannot be exact, but it's a good estimate. So looking at the data here, you can see that people of color are most affected as opposed to white people. We can see that the majority are men. Okay, and we can see here that the biggest age affected is 25 to 54. And here we can see how the veterans are affected. We can see the chronically homeless individuals versus chronically homeless family members, and the substance use disorder percentage breakdown. On the next slide, we have persons with HIV and AIDS that are affected, serious mental illness percentage breakdown, physical disability breakdowns, developmental disability breakdowns. On the next slide, we have domestic violence experience. We can see that this has gone up over the years, and see that we have the homeless due to fleeing domestic violence, and those numbers have also increasingly gone up since 2018 to 2022.
Okay, efforts, services, and advocacy. So over the last 5 years, the LAHSA, which is the Los Angeles Homeless Service Authority, and its partners have made 84,000 permanent housing placements. That's enough to fill Dodger Stadium 1.5 times. And last year alone, the rehousing system made over 21,000 placements. With emergency shelters, there's help from the federal government and the state of California through innovative shelter programs like Project Room Key and Project Home Key. And LA County saw a 12% increase in its sheltered population. So this is over 20,000 people in 2020, while LA's shelter population grew by 8.7%. This is over 13,000 people. The city of LA also saw a drop of 1.4% in the number of people experiencing unsheltered homelessness. With affordable housing initiatives, the LAHSA recognized the city of Los Angeles for its progress in creating more affordable housing in the past 5 years than the previous 30, which is a really big deal. And the projection that Proposition HHH will exceed its goal of bringing 10,000 units of affordable and permanent supportive housing online. For those of you who don't know, Proposition HHH was an initiative to issue up to $1.2 billion in bonds to finance construction of housing and facilities for the homeless population, and also having oversight and accountability there. So skills training programs. These are programs that are designed to help the unhoused get access to mental health professionals, medical doctors and dentists, addiction counselors, clothing, meals, transportation, job skills training, cell phone, and computer access. And a lot of the people helping the unhoused were once homeless themselves, and they completely understand the unique challenges that the unhoused face. It would take 3 to 4 years to end homelessness in LA if no additional people became homeless. Last year, I referred to that number. We rehoused 21,000 people, nearly 1/3 of the people experiencing homeless at any point in time. But the problem is there's more of a flow of people falling into homelessness faster than we can solve the problem. So how do we prevent homelessness? Let's talk about pandemic efforts. So during the pandemic, LA's had an eviction moratorium. There was utility assistance, there's federal and state unemployment relief, which helped prevent homelessness. LA County is working to improve our safety net and prevent more homelessness by improving connections between mainstream systems. So this includes pilot programs to predict and prevent homelessness, rental subsidies and shallow subsidies for the most at-risk households, and improving housing support for people exiting the foster system, prison system, and county hospitals. So an overview of homelessness, micro, meso, and macro. So examples of homelessness on a micro level, models with micro level perspectives focus on individual factors such as a family history of mental illness, current substance abuse, or previous physical and or sexual abuse. Examples of homelessness on a meso level, they're models that focus on organizations or systems in society, such as neighborhoods, local community, access to resources and safety nets, the foster care system, or the healthcare system. And examples of homelessness on the macro level focus on societal, structural, or systemic problems with environment-centered factors such as major societal economic changes. So an economic depression or recession that leads to decreased jobs and housing opportunities, the deinstitutionalization of mentally ill people with the associated decreased funding of mental health treatment services and community-based support services. So let's talk about interdependence. Interdependence is the core principle of ecology. It refers to how different parts of the ecosystem are all interconnected. Changes to one part of the system will have ripple effects that impact other parts of the system. So homelessness, as we know, is a complex problem. It's one with many unknowns, and it must be tackled through a series of interrelated initiatives. We cannot solve complex problems by solving only one part. The challenges related to homelessness come from a larger system of interacting networks. So here you see the Foster, Fisher, and Watson cloverleaf, which has power, mindsets, regulation, connections, components, resources, and are all connected by interactions throughout all the systems. And these are only some of the things that are mentioned here that are important. But as you can see, there's a lot that goes into play that makes these problems very difficult to solve. Affordable housing as an illustration of interdependence. So with regulations, it's difficult to build affordable housing in Los Angeles because developers can make significantly more money renting units out at the market rate. And the city incentives that the city of LA are offering to developers are not enough to excite them to build more. From 2010 to 2019, LA lost 111,000 affordable homes. With mindset, most taxpayers and voters do not want affordable housing or unhoused pods in their neighborhood because they think it brings in crime, drug abuse, and people with mental health issues into the neighborhood, making it less safe. As a result, with power, you've got local and state politicians that worry they'll be voted out of office should they approve zoning for affordable housing or unhoused pods in their local cities. So they're slow to enact change. And then with resources, we're relying on private developers who are influenced by money and not public service. And then looking at the components, to qualify for affordable housing units, tenants must demonstrate an annual income of $41,700 or less to qualify. And an affordable one-bedroom apartment typically goes for $1,500 a month. So after taxes, you're looking at 60% of your income going towards rent, which doesn't leave much for food, health insurance, transportation, and everything else necessary to survive. Again, with a microsystem, an example of this would be an individual or family in Los Angeles having a hard time finding affordable housing. And as they're pushed out, they're relying on the MESA system for help. The MESA system are churches, local groups that act as stopgaps to stop families that are experiencing homelessness. They also give clothing, food, and healthcare resources so they can spend more money on housing to keep them from being unhoused. And then the macro system, which within LA County is the LA County and California state government needing to move faster for the public good to designate areas for affordable housing and improve the zoning.
Okay, moving on to 4 principles of ecology, cycling of resources. Examples of resources are people, money, time, events, supplies, things like this. The definition of cycling resources within homelessness, identifying the resources most needed within the unhoused community, creating the resources and distributing accordingly on a micro, meso, and macro level. And then tapping into our collective ability to help, we multiply contributions and hard work into immediate relief for neighbors who need food, housing, healthcare, and financial assistance. And this is a statement from United Way of Greater Los Angeles area. And here we just have a little demonstration of micro, meso, and macro. So as we mentioned before, micro actions of individuals, meso parts of the society, groups, organizations, macro impact is society as a whole, political, economic, and social factors. Next, we have mental illness as an illustration of cycling of resources, micro, meso, and macro. United Way Los Angeles strives to partner with experts to provide resources on a micro, meso, and macro level to those experiencing homelessness through programs such as following grassroots advocacies and training organizations. Homeless Healthcare Los Angeles helps our neighbors experiencing homelessness with their mental health needs every day. The experience of losing your home in and of itself is an emotionally distressing experience, said Joanne Hemstreet, LCSW Clinical Director of Behavioral Health and Programs at HHCLA. While some people experiencing homelessness are struggling with more severe mental health challenges, I think almost everyone who has gone through the experience of losing their home has some level of emotional distress. So mental health needs are pervasive in the work and everyone needs support. Access to housing provides the stability that people experiencing homelessness need. That's the key insight behind what Housing First approach is. Once housed, they can begin to work on their mental health and wellness and more from there. HHCLA aims to meet people experiencing homelessness where they are on a micro level first, to remove as many obstacles as possible in order to provide the help they need, which is described as in their approach as rooted in harm reduction, meaning the quitting substance use is not a precondition to receiving services or care. Rather, their efforts focus on safety first. Throughout the pandemic, HHCLA has kept their doors open and has added telehealth services. They also modified their groups and programs to be COVID safe. HHCLA describes the internalized blame that she sees in many of her clients. The criminal justice system and aspects of the mental health system often ask people to look at their own morality as a consequence of their circumstances instead of looking at the trauma and external factors. I see a lot of people starting substance use to alleviate psychiatric or physical pain. Substances help people cope, she said. Also, when people are living paycheck to paycheck and they're one paycheck away from losing their housing, even if you have a health issue, it's a waterfall effect. United Way has partnered with HHCLA for years. The most recent engagement was around the Health Pathways Expansion Grant last summer. HHCLA is the behavioral health partner among 16 grantees for this program to expand their care for people experiencing homelessness. The Health Pathways Expansion Fund has allowed the program to hire a coordinator role, which will allow them to bridge clients with the clinical staff. They increase access by adding hours for a psychiatric each week. This allows for hundreds of additional evaluations and assessments, as well as bringing a full wrap around service to more than 80 additional people. We have seen engagement and retention increase for our clients because of the funding from United Way, Joanne said. Retention helps clients stabilize. Sometimes you connect with someone and follow up with them in months and even years down the road. This is helping people stay engaged.
Adaptation. You'll recognize some of these definitions from our textbooks. Adaptation is systems must cope with and adapt to changing conditions in an ecosystem. Resilience in an ecosystem is measured in the capacity of the system to continually change and adapt in the face of disturbance, stress, or adversity. And organizations demonstrate adaptive capacity when they monitor, assess, and respond to internal and external changes. So healthcare can be an illustration of adaptation, at least the way that people experiencing homelessness can access healthcare. So when you're homeless, you have more health problems. That's just a given fact. In fact, people who become homeless are more likely to have health problems than people who don't become homeless. And once they're homeless, they're more likely to have their health problems worsen and less likely to be able to seek care that would address these problems. The emergency room of local hospitals is the most common place for those experiencing homelessness to receive health care because no one can be turned away from the emergency room. And many emergency rooms are readily available in urban areas where a lot of people experiencing homelessness reside. But this is a huge financial burden to local hospitals and taxpayers, of course. So an adaptation that happens at the state and federal level, given all of this, is in an attempt to ease the burden on local communities, state and federal Medicaid funding increases so that hospitals have the funds to meet the needs. In fact, most of homeless inpatient healthcare is paid for through Medi-Cal in our area, the state federal insurance program for the poor, or Medicare, the government insurance program for seniors and people with disabilities. And then local communities adapt as the need continues to grow for healthcare among people experiencing homelessness. Local hospitals and nonprofits find ways to collaborate and share information with each other in order to get help for people who are living on the street and get them out of a vicious cycle for good. In fact, Sacramento, California is piloting a collaboration between 4 major health providers to improve care for those experiencing homelessness in their area by sharing data in one database, not just for patient records, but to keep individuals connected with all sorts of information in order to help end homelessness for good in Sacramento.
Okay, Moving on. What is succession? Succession refers to the more or less predictable and orderly changes over time in the composition or structure of an ecological system. Succession enables community psychologists to take the long view in understanding historical swings of perspectives and power that influence how social issues are framed and addressed. Succession and Judge Carter's impact on Skid Row. So in April of 2021, U.S. District Judge David O. Carter called for a drastic measure to shelter and house every homeless person on Los Angeles Skid Row, which obviously we're probably all familiar with Skid Row and how big of a deal that is to order every homeless person to be housed. And much less, he ordered this for, the initial order was to do so within 180 days. The order highlighted the extreme challenges to address larger systemic issues on a macro level, which makes such a task difficult to create the lasting change desired, as opposed to short-term fixes that may worsen the issue if mishandled. Carter's order granting a preliminary injunction on the Alliance case eloquently explains how decades of structural racism, financial neglect, a policy of containment, and a weak local public sector has produced the humanitarian crisis now confronting us. While the county touted the creation of roughly 1,500 beds for people with mental illness and substance abuse issues as a part of the historic settlement, Carter said he felt that the number represented is the bare minimum. LA City Council President Paul Kokorian, who spoke on behalf of the city at the hearing, similarly noted that while the bed totals showed progress, he felt it would amount to only incremental improvement in the region's homelessness crisis. The judge pointed to a 2019 report by the county's former mental health director, which said that the county may need to fund around 3,000 additional beds for people with mental health issues. The need has likely grown since then. While the long-term goal still may be far from reach, Judge Carter has begun a historical effort to begin to address the homelessness crisis in Los Angeles, starting with Skid Row. This is a profound beginning that gives hope to a path forward.
Another example of succession is the pandemic effect on homelessness in Los Angeles. It began as a macro system event with the microsystem individuals most affected by it. But curiously, because of a bunch of countermeasures that were taken in Los Angeles, homelessness grew less than it has during any other period. So there was a successful call for federal funding to place people in protective housing programs, reduce shelter density, conduct contact tracing for COVID, and prioritize vaccinations for homeless people. The hope was that the pandemic would have no worse impact among the homeless than among the general population, but that was not to be. Researchers from USC, UCLA, and the LA Department of Public Health tallied 256 COVID-related deaths among an estimated 52,000 people experiencing homelessness between January in 2020 and November 1st in 2021. While homelessness grew by 13%, a little less than in recent years, something experts credit to the pandemic-era safety nets like rental assistance, eviction moratoria, and stimulus checks. Without those safeguards in place, researchers estimate homelessness would have grown by 23% during this time.
So another example of succession is the impact of World War II on homelessness in our area. The Los Angeles homeless crisis largely began during World War II, when housing development could not keep up with the city's population growth. And then it grew exponentially due to ineffective state and federal programs and initiatives. As the war ended, it was estimated that 162,000 families, 50,000 veterans among them, were forced to reside in tents, garages, vehicles, and other substandard accommodations. In response, the federal government built nearly 1 million units of temporary and permanent housing nationwide, and thousands of units in Los Angeles, including over 1,000 units of permanent public housing. A rush of federal housing development and widespread rent control was enacted in 1942 in response, but post-war redlining and exclusionary zoning practices excluded most people of color from the post-war housing boom, setting the stage for racial disparities that continue to this day. During the post-war period, public and private welfare providers tended to view homelessness not as a symptom of an uneven labor market or a sign of unmet demand for government-subsidized housing, but instead they viewed it as a problem of disability, employment history, and individual pathology. In the 1950s, most private shelters and indigent services were clustered around the city's downtown. Once known as a way station for seasonal workers and individuals and families migrating into the city, the Skid Row area was transformed almost overnight into a community associated with unemployed or underemployed older white men, many of whom suffered from alcohol dependence and physical and mental disabilities. Thus, this is how Skid Row was born.
So empowerment. Empowerment is the increasing of power. As a concept, it's often described as a value, process, and theoretical framework. Changing power distributions is an essential part for promoting social justice and restoring equity. Empowerment involves the mechanism by which people, organizations, and communities gain mastery over their lives. Empowerment is about obtaining, producing, or enabling power at the individual, group, community, and social level. And what is key is control over resources. So some empowerment intervention examples on the micro level. Something as simple as allowing people to select their own groceries at food pantries gives empowerment and agency to people whose dignity is stripped each time they try to access basic services. Just allowing people to shop for food in the most normal way reinstates dignity and empowerment at a micro level that can enable individuals to feel empowerment when advocating for themselves in other more tedious levels. From a MISO standpoint, eviction assistance, anyone getting evicted gets temporary bridge housing, employment, or welfare assistance. And on the macro level, countywide community psychology vote, in which all of the CP leaders ask the population that are unhoused to vote on what areas they need most help with and enact legislation to affect those specific needs. This would allow the systemically neglected population to really have a voice, be liberated, and have more of an active leadership role in their own issues.
So getting to prevention. Prevention can be defined as keeping something that would have happened from happening. Problem with prevention sometimes when it's applied to mental health and psychosocial problems is that many of these social issues are ambiguously defined, causing multiple factors that are difficult to assess. So there are three approaches to prevention. Universal prevention, available to the general public that has not been identified on the basis of individual risk. Selective prevention, which is targeted at individuals or subgroups of the population who have significantly higher than average risk due to membership in a certain group. And indicated prevention, which is targeted at high-risk individuals who are identified as already having minimal but detectable signs, symptoms, or biological markers indicating predisposition for the problem, like children having disciplinary problems at school. Universal and selective prevention take place before a problem has occurred. Indicated interventions are used during the early stages of a problem. And then here are some prevention intervention examples. If you took our previous example of universal basic income could prevent the need for nonprofits at the local level to intercede and fill the gaps for food, clothing, and shelter for the poor and unhoused. Universal basic income could prevent the depletion of state budgets at meso level for cities. Large portions of city budgets in many Southern California cities go toward local police forces responding to calls about unhoused people living on the streets, urinating in public, and having mental health episodes in public. cities would be able to shift state monies toward community development and housing instead. And finally, universal basic income could prevent attitudes within our larger culture at the macro level by eliminating an economic caste system of our culture and the attitudes toward the poor and unhoused as, for example, lazy, inhuman, or even that horrible moniker of welfare queens. Universal basic income would allow for dignity and agency for all people.
Okay, moving on to some more examples of prevention interventions. We have activities that reduce the prevalence of risk of housing crisis within communities at a meso and a macro level. In the first category of prevention, we recognize that housing crises can be reduced systemically when multiple sectors focus on the big picture goals. 1, ensuring an adequate supply of affordable housing. 2, addressing systemic racial inequities. 3, improving education and meaningful and gainful employment. 4, ensuring access to affordable childcare, legal assistance, and physical and behavioral health care. Such multi-sector strategies can have the greatest impact on preventing homelessness. The next one we have is activities that reduce the risk of homelessness while households are engaged with or are transitioning from systems. This is at a macro level. Homelessness can be prevented through enhanced cross-system collaboration, including systems such as healthcare, child welfare, and corrections. Such collaborations includes increased awareness and attentiveness to housing stability, as well as effective transition and/or discharge planning. In this category, July 2019, U.S. Interagency Council on Homelessness, U.S. Department of Housing and Urban Development, U.S. Department of Veterans Affairs. 3 systems must ensure that individuals are linked effectively to mainstream resources, including employment and healthcare, to reduce the risk of homelessness upon discharge or following the end of the service provision. And the last example is activities that target assistance to prevent housing crises that do occur from escalating further and resulting in homelessness at a meso level. Assistance helps prevent housing crises that do occur from escalating further and resulting in homelessness. In most communities, this assistance is provided through mainstream systems and/or the homelessness service system. Prevention services in this category often include a combination of financial assistance, mediation with landlords, legal services, and other supports. When multiple systems provide prevention assistance, it is critical that they can be coordinated and utilizing common assessment tools to identify and assist those at the greatest risk of homelessness. And that's the last example and the end of our presentation.